the treatment options for patients are so limited when you start talking about we're going to do scaling and root planing, scaling and root planing, scaling and root planing. Why not grow some new bone? Why not take care of that patient in a real way? Who wants to have conventional full flap apically repositioned surgery when you can use this tool and do something that is significant for the patient using a laser, minimal to no pain, no packing. You get to keep your gums where they without that sensitivity. I tell you, if you're doing it any other way, I think you're really doing it the wrong way. In our practice, we average between 5 to 6 surgeries, full mouth osseous surgeries using PerioLase every single month. I tell you what, the technology is amazing. It's been around for a good while. Back when I first started using it, pretty much it was a lot of GPs doing it. Well, now I think, 60-70% of the AAP, the American Academy of Periodontology, periodontists have it. Well, why can't we have it? It's not hard to use. They give you the training that you need. It's hands-on, and it's simple. And I think it's an investment that's well worth it. In the long run, you'll pay for it in the first 3 or 4 months. So it's something that I highly recommend, and I have been recommending it for the last, 20 years plus. So good talking to you guys. Bob, love you, brother.